I'm glad that you're here. Some of you are live. Thanks for being here in the moment. And we are recording this for those of the participants who registered who couldn't be here tonight in person. But I'm glad that we've got a few people. Feel free to put comments in the Q&A and I will check those occasionally. Our class tonight is on chapter 10 of your Preventing Diabetes book. And we are going to talk about sleep. And then I'm going to add a little bit of information on stress management as well. That's not really in your book, but we want to kind of round out thinking about things that affect your blood sugar. Barbara says she's here and she's saying hi. Hi, Barbara. Thanks for putting that in the chat. Alrighty, my name is Megan Ellison. For those of you who don't know me, I'm a registered dietitian nutritionist. I'm also a certified diabetes care and education specialist. Those are my credentials. And our sponsor tonight is Stilly Valley Health Connections up in North Snohomish County. And I did not get their little logo on this slide, so I will be sure to add that logo. So thank you to Stilly Valley for sponsoring our class tonight. And they've sponsored this whole series throughout the year. Class 7 homework. So we talked all about exercise, both actual exercise and what we call non-exercise activity thermogenesis, or NEAT activity last time. So basically both things that we would consider, exercise and just all those other activities of your daily living and all of the little tiny movements that we do throughout our day that also affect blood sugar and weight management and stress management and all kinds of things. So I'm wondering how that went for you. We had a few goals. One was to use the book to write down your active versus non-active minutes in your day and just see like how much are you sitting versus moving in your day. And then we also talked about developing a fit plan, which is basically like setting goals around exercise and getting set up for that. Like, did you need to get any supplies? Did you need to get a gym membership? Did you need a new pair of shoes? That's on my list soon. My shoes are wearing out. We calculated heart rate zones last time. So if you wanted to check that out for yourself, that is in the slides from last month in July. And then evaluate how things are going. So if you would like to put things into the chat, it looks like the chat function is working. Chat or Q&A, you're welcome to kind of share how this month went. And I'll give you some, you can just do that as I continue on with the slides here. And then I'll circle back to that in just a little bit. But yeah, I'd love to hear from you how it went. I did send, I don't know if any of you did that 28-day challenge. It was like a lunge, plank, squat challenge. If you did that, go ahead and, do a shout out to yourself in the chat or Q&A. I did most of the month, although I have a lot of other things going on activity-wise right now, so I didn't do every single day, but I put it on my fridge, and I was thinking about all of you and trying to keep up with those of you who maybe actually were doing the challenge. So if you didn't see that in the handouts from last month, there's a 28-day challenge. Just it kind of ramps up slowly over time. Thought that would be a motivator for some of you. Alrighty, let's talk about sleep. So sleep is super important. The book chapter title says sleep is not optional. And that is because it does so many things for us. One is it does help us to process information, and it really is that moving of memory from short-term into long-term storage. So if you are not sleeping well, oftentimes we do see that affects cognition and specifically affecting memory. Obviously, it's rest and a recovery period for things like your muscles, but also bone, or if you have some wound healing to do. You're in that what we call parasympathetic side of your nervous system, hopefully, while you sleep, unless you have a sleep disturbance, which we'll talk about in a little bit, instead of that fight or flight. You should be out of fight or flight and into the sympathetic side of your nervous system, or what we call rest and digest mode. And that helps you with recovery as well. And then speaking of digestion, so that sleep time gives you a nice long break for your digestion. And there's a lot of things that happen during fasting that can be really beneficial, but specifically thinking about digestion, because I do a lot of like gut health work with my patient population. During that time of fasting, overnight, especially over like a good 4 hours, we get this wave. It's called a cleaning wave. Technically, the migrating motor complex is really engaged during the night or during a longer fast when you don't have food in your system. And those are really strong sweeping motions that help sweep food, but also like digestive juices and bacteria, and it really helps to clean out the GI tract, because we've got, many, many, many feet of small intestine before we get to the large intestine, and it's helping to clean out that small intestine and move things down into your colon to then hopefully have a bowel movement in the morning. So if your sleep is interrupted, or you're not getting good sleep, or you're eating in the middle of the night, and some people actually have like nocturnal snacking happening. Sometimes they don't even know that it's happening. It can be like while they're like sleepwalking and sleep eating. But we really do want to have that break for our digestion as well as for blood sugar. And we'll talk about ideal times for blood glucose control in just a little bit. Sleep helps balance our hormones, including stress hormones and our appetite hormones. So you may have noticed this for yourself, like when you have a poor night of sleep, the next day we tend to be more hungry and stressed out. So it really does affect, we're in that fight or flight more. And so the body's saying, we need to, we need some fuel. We need to run away from the tiger. We need to fuel well for this stressful situation, which oftentimes the things we go for then are, the salt, fat, and sugar. Repairing of organs. We kind of talked about getting into that parasympathetic side, or the rest, digest, and recovery side, including, your brain. Adequate immune function is really important. So, lots of different things going on with sleep. And it's not just the quantity, like the amount, but the quality of the sleep. Let's go ahead. I'm going to ask you guys a question, since I don't see any Q&A responses or chat responses. Go ahead and put in your average of sleep per night. Like, how many hours do you think you're getting on average? So if you think about when you go to bed, you've got that kind of like, maybe you're reading or you're kind of winding down time. From the time you're actually sleeping to when you're waking, how many hours are you getting in a night typically? Ideally, so the American Academy of Sleep Medicine recommends at least 7 hours of good quality sleep per night. And what we see for best weight control in the research, specifically this is from the National Weight Control Registry. This is free living individuals who also are managing their weight well. Somewhere between 7 to 9, because less than 7 and we have higher cortisol, we have more of those stress hormones happening. More than 9 and we are more sedentary, like more of our day is spent not moving. So there's a window there for best weight control. And then for best blood sugar control, what we're seeing is somewhere around that 7 to 8 hour mark. And this is across, multiple studies. Every study is slightly different, but if we just kind of average that together, around 7 to 8 hours. So Nancy, so yeah, 6.5 to 7 hours. So you're like, right, almost at that 7. So if you could, work on getting that 7 a little bit more every night, that would be amazing. Sleep is hard, and some people just, chronically have been, not long sleepers. And, we do see that adding up over time. So let me clear that out. Alrighty. And then, so that's the quantity, but what about the quality of sleep? So I do know that, a huge portion of my patient population actually has sleep apnea. And sometimes they don't even know that they have this going on. And this is correlated with both overweight, but also with diabetes. Um, so if you have any disturbances happening, like snoring, if you wake up and you are tired in the morning, like you just feel like you haven't rested, you're having morning headaches, if you've got like dry mouth, like you've been trying to get air through your mouth instead of your nose, like your nose breathing isn't working, um, episodes of not breathing during the night. Sometimes, a partner can kind of alert you to that. Or if you wake up gasping for air, if you have a family history of sleep apnea, and just obesity in and of itself can be a cause of sleep apnea. And the problem with this is it's a vicious cycle with your weight and with blood sugar control. Because if you've got this sleep apnea going on, then it actually makes it harder to lose the weight and it makes it harder to control your blood sugar and other things like blood pressure and cholesterol because of those stress hormones are always being like ramped up through the night and you're always in that fight or flight. You don't get into that rest and digest mode, which we, really need for that recovery and for bringing down your blood sugar over the night as well. So if you feel like you have a sleep disturbance going on and haven't been checked, I would definitely bring it up with your primary care doc and consider, just like a sleep screen. And then potentially coming out of that, you might get a sleep study either at a facility, but more often now they're actually done at home. They like, give you a device and you just do it in the comfort of your own home, which is kind of nice. Um, yeah, I'm just looking at the Q&A comment on like, yeah, you're up with potty breaks and dry mouth and then too hot and too cold. Those are all things that impact our sleep quality through the night for sure. Okay, and we'll talk about some sleep hygiene ideas a little bit later. It's a great comment. Okay. If you do have sleep apnea, I say here like wear your CPAP, but I will just do a shout out for all the other things that you can be doing that affect sleep apnea. So if the CPAP isn't working for you, a lot of my patients are on BiPAPs or are using dental appliances, or some of them needed actually like surgery, like adenoid surgery, or some of them actually now are doing some medications that have been shown to be helpful for sleep apnea. Like, let's say they tried the CPAP and it just did not work for them. There are other options out there. So, I would not give up on this because this is foundational to the rest of your health. So if you haven't figured out something that works for you to get really good quality of sleep, you need to go back to your sleep specialist or back to your primary care doc and don't take no for an answer. Get it figured out because this really truly is affecting everything else in your health. Lyle is asking, do we put comments in Q&A or chat? Either one. I will see either one. So whatever you want to do. Okay. So super important to address the sleep stuff. Does anybody have sleep apnea that you want to share or anything that has worked for you for getting better sleep? That would be lovely to hear from you. Here are some effects of poor sleep. So of course, sleepiness during the day when we should be more productive and awake, mood disturbances, concentration and attention issues, cognitive impairment, sometimes driving accidents if you're really tired. We do see this affecting growth in our developing kids and teens, inadequate repair, risk of chronic infections. So that kind of goes back to, or conditions, that kind of goes back to that immune and high stress hormones. So we do have strong associations with obesity and not just how much we eat. So it does ramp up those appetite hormones like the ghrelin. Both ramps up ghrelin and decreases leptin, which is a satiety hormone when you have poor sleep. So we're more hungry, and it's not just the total amount, it's actually changing what typically people will choose. So I kind of mentioned that salt, fat, and sugar thing. Typically, we want to go for those more snacky foods when we haven't been sleeping well. So yeah, so it affects both quantity and quality of food intake typically. So I mentioned the 7 to 8 hours optimal length for blood sugar control. And part of this has to do with like that cortisol, that stress hormone, but also human growth hormone, which is a repair hormone. And insulin sensitivity is reduced with sleep restriction. And then, of course, we do see correlations with heart disease and poor sleep, and specifically with like major events and sleep apnea, like a heart attack and sleep apnea, if it's the sleep apnea is not addressed. So yeah, we definitely want to address those things. Okay, Vicki is sharing that she has sleep apnea and it's well managed with your CPAP. Yay, that's so fantastic. Recently got an adjustable bed and sleep quality has greatly improved. That's amazing. So you can adjust, like tilt up your head a little bit maybe. For some people, like especially with reflux or with like the breathing, especially if you have obstructive sleep apnea, that actually change in angle may be helping things. Thank you for sharing that. That's a great tip. And then Lyle says, I have sleep apnea, use CPAP all night. Good job. Lately have been using a strap to keep the mouth closed. Yes, I've been hearing this from my other patients too, that some of them are using the little, like, things to keep their mouth closed during the night. And so it's just using their nose, which is interesting. I've had 3 root canals in 4 years due to dry mouth. Yeah, that's so fascinating. And then kind of spinning off of that, any sort of like bacterial infection or overgrowth in the oral cavity, we do know affects your other health. So it affects your heart health, it affects your blood sugar control. So good for you for managing your oral microbiome, your oral health, that then affects the rest of your health. That's great. Good tips, you guys. Thanks. Okay. So here are a couple things I just want to mention as far as like sleep hygiene goes. So ideas for getting a better night's sleep. Ideally, we do want light. If you are a shift worker, this is kind of, a different thing. But ideally, in the morning, we would have natural light exposure when you are waking. If you're on shift work, do it anyway. Like get up and just like get some sunshine. Ideally, outside, real light, not through a window, so you get the full UV spectrum. Or for some people, especially here in the Northwest in the winter, like having a full spectrum light box, they're like they're like the size of a Kindle, and they're like $25 online. And you can put that like in your bathroom or where you have breakfast in the morning if you're like super busy and you can't find the time to get outside, or if your schedule is such that you're getting up in the dark, it's helpful to have that full spectrum UV when you're waking. So that can be helpful for some people. And then in the Northwest here, or like in Alaska, it's just dark a lot in the winter. So the daylight, getting that full spectrum UV helps us with our circadian rhythms. So then we are also more ready for bed at night. We want to be careful about artificial light at nighttime. And we've got, all these devices and screens and things that are throwing blue light at us, especially for like, it's like right into our eyeballs at night. that artificial light does stimulate our pineal gland in our brain to suppress melatonin that helps with sleep. And it actually helps release like an alert type hormone that's opposite of melatonin when we've got that light coming in. So ideally, you would have like a good hour before you are trying to go to sleep without screens. Dim the lights if you can in the house, just kind of get ready, almost like you're simulating sunset, getting ready for bed, because it will tell the body that it is time for sleep, and it helps the brain to get ready for sleep. Create a routine. This is helpful for a lot of people where they have like a kind of pre-bed ritual. So that could be like some stretching or yoga, maybe a nice cup of non-stimulating tea, like a chamomile. Some people who are really, thinkers and kind of can lay in bed at night and just think and think and think. Journaling can be helpful so they kind of get their thoughts out. Or if you're a planner, and you're just thinking about what's coming up for the next day, sometimes making a list of those things so it stays put, so you don't have to keep ruminating over it and keeping the list in your head. It can be helpful to just jot it down. So for some of those people, some of my patients who like either do that trying to go to bed, or they wake up in the middle of the night and then they start thinking, having a notepad and pen right next to the bed, even if you don't turn the light off, but you're like, oh, I got to remember this one thing, and you just kind of jot it down, it'll help you go back to sleep, because then you don't have to keep remembering it. Sometimes you can read your writing in the morning, sometimes you can't, but at least you've gone back to sleep, which is the whole point, the good thing. Meditation, deep breathing. Yeah, if you guys have any strategies for sleep hygiene or ways that you have found to be helpful for your sleep, let me know. Let us know in the Q&A or the chat. And then temperature is an interesting one. So we do see this kind of stimulation to fall asleep when you have at least a degree of drop in your body temperature. So this can be manufactured with like, a hot shower or hot bath or like a hot tub at night. And then that heat, as you are cooling off, it triggers the body to go to sleep. And then to stay asleep, ideally the room would be around 60 to 67 degrees. Everybody's a little bit different in this as far as, exact temperature. But I do find that a lot of times temperature is a big one, for especially for like, females going through perimenopause or even postmenopause, especially for people who maybe are having a cocktail or a little bit of alcohol with dinner or in the evening. Sometimes they can have that hot thing happen during our detox in the middle of the night around like 2 or 3 a.m. where your temperature is ramped up a little bit. So, having the room the right temperature, having the right seasonal bedding for the season that it is, maybe having a fan, all of these things can be helpful. Actually, I think I have some of this in the next slide here. Yes. So the fan can help both with temperature, but also giving you a little bit of white noise in the background. Or if you're super sensitive to noise, using earplugs. Do think about, how comfortable you are. How long has it been since you replaced your mattress? Sometimes it's like decades, and then, it's really time. Is your bed crowded? Like we have geriatric cats that sleep with us, and I love it, but sometimes sometimes I just have to kick them off the bed and, put them under little pillows, because not on the bed, because they're too hot or they're too restless and it's affecting my sleep. So sometimes it's, pets are getting in the way. Is the bedroom a haven for rest? And what I mean by that is like, are you associating the bedroom with sleep and rest? Or are you trying to do a bunch of other things like watch TV? Sometimes people are even eating in bed, which is a huge no-no from like a circadian rhythm, digestion, and like oral health situation. Um, yeah, we just want it to be this haven where like that's where you go and your body knows when you go to this room, this is what I'm doing here. I am resting versus other things. Hopefully you don't have like a desk or like an office in the same place as your bedroom. Some of this got really confused during COVID when a lot of people were working from home, um, and could work at any time of the day or night, right? Um, okay, other things. So, speaking of like the stress side of things, meditation, lowering that those stress hormones, getting into the rest and digest mode can be done with like a couple minutes of deep breathing, like especially that diaphragmatic breathing where you're getting into your lower belly. For some people, prayer works. They basically all meditation, breathing, and prayer really tap into the same thing biologically. And what else? Some of this we've already talked about. Exercise. So let's talk a little bit about activity. So being active during the daytime does tend to help with better quality sleep at night. So having that exercise routine, but do be careful with your timing of the exercise. Some people really can't do it late at night. It kind of wires them. They have that adrenaline release, especially if they're doing intense activity and then they're wide awake trying to go to sleep. So, learn what works for you. And if you can be, higher intense during the day as far as your activity goes, and then kind of wind that down, finishing the day with just gentle things like the stretching or the yoga or the deep breathing, can be helpful, not stimulating those hormones that keep us awake. Okay, if you have any other ideas, go ahead and put them in the chat. Let's talk about food and substances. So we do have many, many options these days for caffeine intake. Not just, here in the Northwest where we love our coffee, but like the 5-hour energy shots and the energy drinks these days. And there's stimulants added to all kinds of supplements and like supplemental food things. Um, where a lot of my patients I'm seeing, once we add it all up, they're getting a lot of caffeine. And sometimes we don't even realize like how much it is affecting our sleep. But the half-life of caffeine for most people is about 6 hours. So if you are having a cup at 9 in the morning, coffee or whatever, 3 o'clock in the afternoon, half of that caffeine is still in your system. But if you're having a cup at 3 p.m., half of that caffeine is still in your system at 9 p.m. And if you have the genetic mutation where you don't break it down as quickly in your liver, it could be lasting a lot longer than that. So some people are just chronically wired from too much caffeine intake. So I would think about like how much you're having. The upper limit that's recommended to stay under is 400 milligrams of caffeine a day, which is like 4 cups of coffee. So how much, and then when is your cutoff? And you might just work on like, kind of backing that up. So if you're still having something in the afternoon with caffeine, just start slowly moving that earlier and earlier and see if that impacts your sleep. It very may well be impacting the quality. We do see with eating that, there's kind of a happy window. So you don't want to go so long that you're hungry again. Remember with blood sugar, like back to our earlier classes, if you have your dinner and it's a well-paired carbohydrate, protein, fat mixed meal with fiber there, it's going to take about 3 to 4 hours to, increase and then decrease your blood sugar. So you're digesting and absorbing, and you've got that glucose on board during that time. After that 4 hours, a lot of times we get pretty hungry. So if your dinner is so early and your bedtime is late, that you're actually getting hungry like 3 to 4 hours later, it might be best for you to actually have a snack before bed. Something with protein and a little bit of carbs, because it's the carbs that you can run out of in the night and then have that rebound blood sugar high by the morning. But it's also the protein that slows it down and makes it last you longer and makes you more satiated or full going into bed. So if you are a late night person, you're up till like midnight and dinner's at 5, you probably need like an 8 or 9 p.m. snack to then not be hungry going into dinner or into bed, and you still have plenty of time to digest that snack, right? Ideally, we wouldn't have a bunch of food within a 3-hour window of laying down, both from like a reflux sense, having potential heartburn, reflux, and just from a quality of sleep sense. So we know that large meals and then, going to bed, or even like some of my patients do this like snacky thing. They just kind of start dinner and then snack through the evening until bedtime. That is really hard on your quality of sleep, because then your body is busy doing all that digestion instead of resting and repairing during the night. So, just think about your timing with things, play around with it. And ideally, if you do have that snack before bed, it would be something that's really easily digested. So like a Greek style yogurt, for example. You've got carbs and protein together in there. It's not going to cause reflux. It's got that calcium and magnesium to kind of calm you down and calm down stomach acid. It's, easily in and out of your system as far as like your stomach goes. So, most of my patients do really well with that. Or like crackers and cheese, something simple. Or if you haven't had your fruit for the day, like maybe that's where you put a little bit of fruit with nuts or with some peanut butter, for example, before bed. Something simple and small. We already talked about alcohol affecting circadian rhythms and temperature, but also it's blocking that REM sleep. And then sometimes it also causes a little bit of a diuretic. So then it causes you to get up in the middle of the night to go to the bathroom. There's all these impacts that alcohol can have, and it's all pretty negative on sleep quality. So careful with that. Nicotine is very similar to caffeine. So if you are using nicotine, be careful because it's a stimulant. And so you want to kind of do the same thing where you're weaning and stopping that earlier in the day. And then have a conversation. If you feel like, your sleep is not where you want it to be, talk with your healthcare provider. If you haven't been screened for sleep apnea or, sleep disturbance, but you think it might be going on, really important to get that addressed. Okay. Well, looks like we don't have anything in the Q&A. Let's look at the chat. Okay, so circling back to the exercise question. So Nancy is saying she joined a gym. That's amazing. And getting 7 to 1,300 or 7K to 13,000 steps per day. I'm not sure which one that is, but you're tracking your steps, which is what matters. So you're getting that feedback. You're getting the awareness, which is amazing. Oh, wow. Okay, you're only getting 3 hours of sleep. Holy moly. Yeah, that definitely needs to be addressed. Wow, Lyle, 9 to 10. Oh my goodness. You're a sleeper. Okay, let's see. Virginia, 6.5, might be in bed for 8 to 9. So yeah, so you're not sleeping all of that time. Interesting. Okay, Barbara says either 7 hours unless I'm unable to sleep at all, at least twice a week. Wow, so it's kind of intermittent. Goes in waves, it sounds like, for you. And then yes to apple and peanut butter. That would be a great snack. before bed. The peanut butter has the protein and fat. The apple has your carbs and, some fiber and moisture there. It gives you a little something to actually crunch on, which is really nice. So that could be a nice pre-bed snack for more stable blood sugar through the night and a little bit of protein. So you've got that protein to not have as much muscle loss, which we do see more muscle loss overnight, especially as people get older, like over the age of 65, that ramps up. Okay. Let me just check. Alrighty. Let's move into talking more about the stress side of things. And by stress, I mean like any sort of, stressor in your life, which could be, a mental health concern. It could be depression. It could even be things like attention deficit. Some of my patients who, really are super motivated to be making changes and they just keep hitting that barrier of follow through or not being able to make the change, even though their motivation is really high. Sometimes something else is going on, and we need to remove those barriers for you in order to be able to make the change. So these are just some things to think about. If you feel like you're trying to work really hard and you're not getting anywhere, yeah, we want to definitely address that. And that really is the third pillar: diet, exercise, and behavior stuff, which includes, the things that you would talk with a therapist about. All three of those are really important for making long-term behavior change for health outcomes. Here's some signs and symptoms related to depression specifically. So loss of pleasure in doing things you used to enjoy, difficulty sleeping, we're just talking about sleep, or sleeping more than usual. If you just are so exhausted and feel like you can't, get out of bed, or you just don't have the motivation to get out of bed, something could be going on there, more mental health wise. Change in eating patterns, like either a lot more or a lot less. Change in weight related to that, fast gain or fast loss. Trouble paying attention, lack of energy, nervousness, feeling guilty or like you're a burden, feeling like nothing matters. All of those can be red flags that there's something going on related to depression or mental health. And especially if this is interfering with self-care or interfering with your, what we call activities of daily living, like eating, regular exercise, taking your medications consistently, seeing your healthcare providers, checking other metrics, like if you have a glucometer or a blood pressure, maybe you're supposed to be checking your blood pressure and you're just not feeling like doing it. There could be something else going on besides just, lack of willpower. A lot of times with behavior change, we have a lot of guilt and shame associated with not being able to make these changes long term. I see this a lot because of, people coming in on diets that are really not reasonable diets, not sustainable diets, and then they feel bad about not being able to maintain it. So, working with a professional can be really helpful because you might just be setting yourself up for not being able to follow through on those if your expectations are too high or if the plan is too crazy. So, that's where it would be good to check in with somebody, either a dietitian if it's food related, or a trainer if it's exercise related, or a therapist or counselor if it's more mental health behavior change related. Okay, stress management is really important for managing your blood sugar. It's both physical stress and emotional stress will raise your blood sugar. I see this all the time in my patient population, but especially my people with continuous glucose monitors that are wearing like those little, we call them CGMs, for continuous glucose monitors, like in their arms, that's checking blood sugar every 5 minutes. They will see when they're stressed out, their glucose goes up. And it doesn't have to be like, physical pain, although pain will increase blood sugar, but it can be emotional stressors that increase those stress hormones that then increase insulin resistance and kick sugar out of your liver. So any sort of stress typically is going to raise your blood glucose. I'm going to send you a couple handouts, one on sleep hygiene and nutrition, one on stress management and nutrition. Actually, it'll come from Christina at Stilly Valley, but you'll get that along with these slides. So figuring out what works for you, stress management wise. For some people, it's, another person. It's talking with a friend, it's a coach, it's a therapist, or it's just being more social in general. Joining a club. I just joined a book club earlier this year and I'm loving that. And then I've been taking some dance lessons, ballroom dance lessons lately. That has been super enjoyable. It's a whole different group of people. So that's gotten me out doing other things. That's both active and social, which is a win-win. Journaling thoughts or emotions, physical activity is a big stress reliever for a lot of people. It literally, burns off the stress. You literally use it. You use the cortisol or you use the adrenaline. Time with a loved one, that could be, a person or a pet. We already mentioned the meditation, prayer, and breathing. Singing is another big stress reliever, or any sort of music or dance. Progressive relaxation. So that is a technique where typically you're laying down and you think about relaxing your body from your toes all the way up through your top of your head. And for some people, that can be really helpful for falling asleep or just lowering those stress hormones. Replacing negative thoughts with positive thoughts. Getting out of a situation that is causing stress if you can. Sometimes we can only, manage our response, but sometimes if you can actually remove yourself from the stressful situation in the first place, that's the best thing. So you're not having to respond at all. Okay, let me check the chat. Any other stress management strategies that you guys have? Go ahead and share that if you found anything to be helpful for you. Okay. And then we've got a few minutes left. I wanted to bring up this handout I'm also going to send you. It's called the 42 Factors. And it was a handout created by a person living with type 1 diabetes, so on insulin, that was basically, trying to understand all the things affecting blood sugar control. And it's at least 42 things. There's many more. But a lot of times I think we put so much emphasis on diet and exercise, which is great because they're both really important. But we do it at the loss of, remembering some of these other factors like the sleep, the stress, environmental things, medication, biological things. So let's talk about a few of these because sometimes people are working so hard and doing quote unquote everything right. Like I just saw a person earlier today with type 1 diabetes that he's had for many, many decades. Amazing management of this chronic condition. And he's worked really hard at it. And sometimes there's just other factors that are affecting your blood sugar that are kind of out of your control, right? So we also want to be aware of those things and not beating ourselves up, especially when you're working really hard to make changes, because sometimes blood sugar is up for another reason, not related to something you have done, right? For example, like under medications, oftentimes blood sugar, most of the time, blood sugar is going to go up if you're on steroids. If you have an injection in your knee for knee pain, for example, expect your blood glucose to go up for about 3 to 4 months, typically, after that injection. Or sometimes even with medications like high dose niacin can increase blood glucose. Sometimes there's more environmental factors going on, like you get a sunburn and it's a stressor. So thinking back to those things that raise blood sugar, that is a stressor on the body. Or anytime you're fighting a cold, you might not even know that you're fighting it yet. Like you might see it if you're checking blood sugar or you have a CGM, you might see it in your blood glucose before you even have symptoms. That happens all the time for my patients. They're like, I don't know why my blood sugar's up a little bit. And then the next day they'll email me and they'll be like, oh yeah, I have COVID, or whatever it is going on. So anytime you're sick, the body is stressed, that's going to raise blood glucose. Some biological things. Let's see here. Allergies. Allergies is a big one. A lot of people deal with chronic histamine release, which is a response to, kind of an over response to an allergen like pollen or grass or whatever's going on. But that is pro-inflammatory in the body. So if you have allergies, you want to manage those allergies really well to keep your inflammation down in the body, to keep your blood sugar and weight lower. I mean, it's crazy how all these things affect each other, right? It's like this web. Even things like, changes in hormones, like with puberty or with pregnancy. Some of you may have first had an inclination that you were having blood sugar control issues in pregnancy because they do that glucose screen. And those hormone changes affect how you're managing blood sugar. And then you think about menopause and changes in hormones at that time, as well as muscle and bone density loss, and that affects blood glucose. So yeah, there's all kinds of things going on. Smoking, because it's pro-inflammatory, that's going to raise blood sugar. Insufficient sleep is on this list. So anyway, I'll send you this handout as well, just to wrap your head around some other things besides food and exercise that is affecting blood glucose. Lyle's asking, what is Dawn phenomenon? So Dawn phenomenon is when you have this increase in blood sugar in the morning, and it's a response to your counter-regulatory hormones increasing in the morning. Counter-regulatory hormones are all those hormones counter to insulin. So insulin lowers your blood sugar. Counter-regulatory hormones increase your blood sugar, like cortisol, adrenaline, epinephrine, norepinephrine. They kick out glucose. They cause glucose to be kicked out of your liver. And so sometimes people are seeing this spike in the morning from those stress hormones that help wake us up naturally. But sometimes people just kind of have an overly dramatic response to it. Sometimes though, I see, because we've got, people on CGMs, so sometimes I see that they're actually going low with their blood glucose in the night, and that's what's causing them to kick out extra sugar. And if that's the case, then sometimes that pre-bed snack is really important. Like they're trying to go too long fasting, and then they're starting to ramp up with that. We call it glycogenolysis. It's the breakdown of glycogen stores in your liver first. Once you've exhausted those glycogen stores, then we actually start this process called gluconeogenesis, or literally making new sugar. And the way we do that is by losing tissue, protein. We can only turn protein into glucose. We don't really turn fat into sugar. And so sometimes when people are going so long fasting that they actually get into that gluconeogenesis state, they're losing muscle faster. So we want to, be careful about how long you're going. We want the fast for sure for the digestion and the repair and recovery, but then too long and you could be losing more muscle and bone density. And I know that there's, a lot of very much a fad right now, the whole intermittent fasting thing. But for some people, they're going too long and it's actually backfiring. So be careful with that, or talk with your dietitian about that to really dial in a plan for you. That's a great question. With that dawn phenomenon, a lot of times people will be put on something that helps lower their insulin resistance over the night, like metformin, for example. Okie dokie. Let me just check the chat again. Oh, good. There's some things in here. Let's see here. So Nancy says, make sure the lights are turned off in the bedroom. Yep. Turn the alarm clock away from the bed. Absolutely. I have to do that. I'm super light sensitive. Oh, you've got a computer in the office of the bedroom and the blue light flashes. Oh my gosh, that would drive me crazy. Now you turn it off. All those little things help a lot. Yeah, absolutely. Fantastic. Sometimes I even put on, like, if my husband's up late or he's, sometimes wakes in the middle of the night and then he gets on his Kindle or he's reading, that light will bother me. So I'll put a sleep mask on and that will just, I'll be out with that darkness. Linda says, in regards to stress management, there's a free app called Insight Timer. Ooh, I haven't heard of this one. There's a search feature for type of meditation or your favorite author to practice meditation with. Oh my gosh, lots of options with this app. So it's called Insight Timer. That's a great tip. Thank you so much. Some of my patients also like the Calm app. It's another one to check out. Great tips, you guys. Thanks for all your input tonight. That has made it even more robust and fun for me. Alrighty, so let's look at your goals, or your homework, I should say. Think about your sleep quality as well as quantity. Maybe you actually do a little bit of tracking or like use a smart device to do some tracking and see what your sleep is actually like. That's actually why I got the first smart watch that I got from my husband back in the day. This was probably 10 or so years ago. I bought it for him because I knew he wasn't sleeping very much, but he didn't believe me. And so he started wearing it and realized, oh yeah, I'm only getting 5 or 6 hours a night. And now his sleep is much better because he's aware of what's going on. Identify specific behaviors you can control to improve sleep. So maybe you're working on some of those sleep hygiene things. Think about potential mental health barriers. Is there anything going on that really needs to be addressed? And then identify some strategies to help manage your stress. Alrighty. Next, this says next week. It's next month. Same time, first Monday, 6 o'clock. I will see you in September, and our chapter is chapter 11, getting, or I like to say keeping your head in the game, because you are all doing this, right? You're here, you're engaged, you're making changes, you're learning things, you're thinking about it. So how do we keep our heads in the game when this is like a long-term thing that we're managing, right? So we'll talk about strategies for that. And the chapter is not super long, so it'll be an easy reading month. But I'm going to add some things to that, some like behavior change strategies to kind of round out the topic for next month. All right, I will hope to see you all in September or chat with you all in September, and have a fantastic rest of your month of August.